started off with some somatic movement, and something we didn't get to share is that we think of somatic movement as the connection between, it's a pathway, right, to optimize that spirit, mind, body interconnection. So there are all sorts of somatic practices, somatic therapy, somatic movement, somatic touch. So we shared in that, and we connected it right to the elements that we find within ourselves and the earth. And it's so important to think about different pathways by which we can promote healing, find healing, with the state of things today and changes coming. And that is really something that inspired me to do this whole event, to try to collaborate with healers in the community and do this event, and to talk about plant medicine as well. I feel that this is a crowd that is already very literate in plant medicine. However, most of us are connected with people who aren't. And so the more that we can be talking about this and causing people to ask questions and stimulating their curiosity, the better it will be for all of us. So I thank you all for being here and participating. Plant medicine, earth honoring cultures, ancestral wisdom for modern metabolic health. Really, what isn't plant medicine good for? But we had to pick something, so that's what we picked. And just realizing that this isn't new. This isn't new. Ancestral traditions are centered around earth medicine and healing from the earth and the community. So it's highlighting that we are really resourcing this wisdom that's already there, and just doing our best to bring it forward if we can. So Sun was nice enough to join me for this. Really, I'm kind of joining her. I guess we can flip the slide and we'll do our intros, right?
Yeah, sounds good.
So Sun was nice enough to collaborate and do this talk. I'll let her introduce herself if we come to the next slide, actually.
Well, everyone I know here, so it's not, very new, but I'm an herbalist, and I've been really practicing since about 2005, just on my own through self-research. I did probably a year of holistic schooling, but haven't gotten a degree in anything. But I feel like as many medical journals and articles that I've read, I feel confident in what I'm talking about. And I make tinctures, salves, creams, oils for pain, eczema, mostly I would say home remedies. So you're talking about, help with bug bites, broken bones, fractures, things that help, that anyone can make with just a few simple items themselves. So I don't want anything that I make to be, unattainable if someone was interested in making it themselves. So, because I do get people that ask, oh, how'd you make that? And they're all ingredients that you can get from either online or in the wild, of course, foraging, or get seeds and grow them yourself in your own garden. So I believe that's me. And the reason that I started, I will say, is that I was raised by two herbalists themselves. So we only did, I would say, a handful of actual doctor visits, and used a lot of herbs, from earaches to even things that people get vaccinated for, like tetanus, chickenpox, and used plants for that that have the same ability to keep them away or aid in it when you have it. So just thought that was something that came natural to me. But I have scoliosis and degenerative disc disease, and had to get 2 spinal surgeries for that with a fusion, and having chronic pain since about 2005, it really sparked me to find an alternative to opioids because it was a struggle, because they did give me those for a couple of years after being introduced to those, that how many side effects there are with pharmaceutical pills, as far as addiction, constipation, breathing issues, circulation issues. I mean, you guys have all seen the advertisements for any drug. It comes with a dozen or two side effects, ranging from diabetes to death. So I thought, well, I know about herbs. I'm going to make something where there are zero side effects, and a lot of plants are available that provide that for people. So that's my story.
Thank you, Sun. Sun or sunflower?
Sun's fine.
Sun.
Yeah.
Just making sure. And then I'm Nawungmé. Excuse my vanity. I was like, we gotta wait for our slides. Do the intros properly. And then we're gonna go back and do the agreements that we skipped over. And I thank you for your patience, because this is my first time doing something just quite like this and in collaboration with another speaker. So yeah, it's a fun learning experience for us all. So a little about my background. I have been in conventional healthcare in the hospital setting and some outpatient settings for several years. Currently, my role is that of a clinical nurse specialist. I say it's like a cousin of a nurse practitioner, but like with fairy wings. Before that, bedside nurse or frontline working in the hospital. And one thing that inspired me to really learn more about, I'll use words like earth medicine here very often, plant medicine, is one, just coming to know just the undersides of the business of healthcare in our country, right? That's on a gross level, but also personally seeing how challenging it is and how little teaching there is about the body, never mind what we're being given to put in the body, the unintended effects, yes, that we're not taught about, and just realizing that this is pharmaceutical medicine and the way that we care for humans. The way that we do it now is, it's not been done very long in comparison with the eons of time that we actually healed ourselves from the earth. And the more I realized that, the more I was like, hey, I've been deceived. Nobody, this has been hidden from me. And the worst thing that you can do is try to hide something from me. Then I have to know, right?
Yeah.
But also seeing the development of the social climate in this country, and knowing how that's going to affect people in so many domains, including health. Very specifically seeing insurance changes, Medicare, Medicaid, but knowing what that is going to mean for so many other people. It's not just going to affect one group of people, it's going to ripple out and affect so many people. And so feeling like I need to be prepared, we need to be prepared to care for ourselves. And I know firsthand, we know so little about how to take care of ourselves. Health ownership is very important for me. I try to champion that, and it is not something that is included in our healthcare system. We ask people to hand their health over and their well-being and say, I'll take care of it, and we don't tell them what our guidelines are around it, what our values, our ethics are around it. We just take it and go with it, and I think that's so unfair. So I could get on the soapbox about that, but that's not only what we're talking about today. As a somatic healer, and as we shared today, this morning, the somatic movement practice, realizing that there's no difference, there's no disconnect really between the mind, body, and spirit, even though we talk about them as if they are. I've really gotten more into bringing in practices that help people connect with the body, deepen into it, heighten your awareness of it. That's allowing us to know what else we need to do to heal ourselves. Start with that awareness. So, and my business is Healing LLC. Spencer, could you do us a big favor and actually go back 2 slides? Okay, thank you, Tara. Welcome. So just so we are clear and establish this with each other, we do want to share today, and we definitely want to hear from you. This is interactive, and just interrupt us or stop us at any time. And we just want to be clear that we're not giving medical advice. You'll hear that again. And when I say that, I mean in a very legal, regulatory way. We are not giving medical advice according to those terms. Are we talking about earth medicine that can help you? Yes. Do with it what you will. Please know where you're starting. Know your individual health concerns. I have type 1 diabetes. That means that I have to put insulin back into my body. I would never tell anyone in that circumstance to substitute it or stop and do something else. I can't say that there's not a shaman out there somewhere that can heal me or heal them. I just haven't found them yet. And so I can't responsibly tell someone that. So we are sharing, and we ask that you responsibly do your research, meditate on this, reflect, and hopefully gain and benefit from what we share. And we are definitely not getting political. Although some might argue everything is political. But in a direct sense, we're not. And we don't support any health movements that are associated with certain political movements, i.e. MAHA. That's not what we're about. Okay? Thank you. And if we can go forward a couple slides to after our intros. All right, so we are going to explore just a tidbit, a morsel of a tidbit, because botanical medicine, plant medicine, earth medicine is so vast. But just an intro about some very helpful, practical information about some herbs that we can find or acquire locally. 2 out of 3 at least we can grow here. And also about plant medicine safety. And when I say that, especially that gray area between, well, I've only taken pharmaceutical meds, I want to take more botanical meds, I don't know how to do that. Or I take pharmaceutical medicine like insulin, I don't know how to combine it. And also, why would a doctor ever tell me that I shouldn't? What is the concern? I'm going to tell you, I'm going to be the first one to say it. I'm in healthcare. I don't like doctors. It's not the people, right? It's what they've been taught, how they've been taught to approach things that I don't like very much about like the title and the position. There are certain things about it I don't appreciate, I can say. And yet, I've had to take a step back and have some humility as I've been learning about plant medicine and say, just like we do in so many spaces right now, even people that we very much disagree with, but pause, is there anything that makes sense about what they're saying? Sometimes there's not, sometimes there may be. So we'll talk about some concerns that perhaps we hadn't considered that may be worth reflecting on from other points of view. How about that? And then we'll talk about, all the good things we discussed, where we can find help and support to do these things locally. Does that sound good? Woo! All right. Let's go on, please. We already said that. No medical advice, especially for anyone who's pregnant here. Hunter. Not for you. No, I'm just kidding. Could you go to the next slide? I have a goose if you haven't noticed, but sometimes I have to slow my goose.
I was going to do the lactating thing from Meet the Parents, where he suckles the kitty cat.
I go.
It's a little.
I have to slow it down sometimes.
Edit that out.
Super live. So whole health. I do want to mention that as in my intro slide, right? I call myself a whole health provider, and that can take in functional medicine, integrative, botanical, and we'll talk about some of that later. And yet whole health it's a paradigm which is being more embraced in other spaces of care, but that our ancestors understood quite well, but that really we have not championed as much in healthcare. We haven't championed it, period. I'm just going to be straight, because I'm in there, I know it. In decades since modern healthcare was established, but viewing what happens to us, our existence as individuals, as a whole picture. We're not systems. Our body doesn't think of itself as a nervous system and a cardiac system and an immune system. Everything works together in concert. So approaching our mental, emotional, physical, spiritual health, physiological, which is different, all is one, is a whole health approach. And so there's so many dimensions to that, but just curious, some of those dimensions, and when I talk with clients, we talk about them in these words. You see on the screen, movement that appeals to you. If dance appeals to you, great. If what's the hardcore exercise that came from the military? I used to do it. CrossFit, if that appeals to you. But if they don't, it's not something that's going to benefit you in a whole manner and not something you're going to sustain. So compelling movement, nutrition, emotional thriving, sleep, quality sleep, cultural connection, earth stewardship. And I'm going to say that one before, cultural connection. When I get excited and nervous, my words kind of move. So just asking the audience, curious, out of any of these, if any of these are areas that you're focusing on right now, which one would you say is more of a priority for you?
Because I've got to leave in a few minutes. Can you just elaborate what you mean by cultural connection?
I'm so glad you asked that, Nancy. Okay. With that, I'll share. So, hey David, welcome. Be careful with those cords. So, understanding that who we are right now is because of so many that were before us. Like it or not, wherever we come from, but you do come from people and places. And that is part of who you are right now. And it may mean that, I have all these talents I didn't realize. It may mean there are things that you need to heal from that have been covered over. It may mean that you have this plant medicine wisdom residing in there that you need to awaken. It can mean so many things. But without taking the time to explore that or discover that, there's a whole piece of that whole health scenario that you can't address, that you can't work with or nourish.
So you're referring to, for each of us as an individual, our personal. Okay.
Absolutely.
Just bringing that up because
Yes.
this word culture and culture wars, you know what I'm saying, is appeared in the zeitgeist right now. In the culture.
Sure. Thank you for that clarification. Yes, on a personal level.
Very cool. Okay.
Yeah.
Do I need to drop your name when I go there, or just say Harvest Collector of Haven?
Starting to decompose. Yes.
Gotcha. Susan?
Thank you. Food donation. Yeah. Any other thoughts on that? And that can be a personal reflection too. That can be a personal reflection. Welcome, new friends. So doing our plant medicine talk, right? And I love that a local figure, that's David, who is well versed in a domain of plant medicine, is here. And so moving to our next slide, we will talk about what exactly we mean when we talk about today when we're talking about plant medicine. Ta-da, that's our section. Next slide, please. Okay, so defining what we're talking about today. So when you hear plant medicine, can I put you on the spot, David? When you hear plant medicine, what do you think?
Psychedelics.
Psychedelics, right? It's sexy, it's popular. Right? But there's so many other, medicinal benefits from plants. Countless. So today when we say plant medicine, or earth medicine, or botanical, intentional use of plants for whatever it is, you might not even know, you might be throwing it at something. Let's see if it works. Or if you know what you need help with, or if you have diagnoses that have been given to you, or conditions that you figured out yourself. That's what we mean. Does that sound right?
Yeah.
Yeah. Okay. Next slide, please. And sustainable medicine. I'm going to tell you, I just picked that term up this week. It seems like the universe was listening, and all of a sudden there was like these webinars and interviews from like really studious, diligent, informed herbalists. Sustainable in the way that is higher care, right? Like it looks like it very well could, like any other establishment, just crumble and fall if it all fell to you know what. Like, what can I go to if I can't go to the pharmacy anymore and just pick this up? What can you go to that's reliable, dependable, to help you for whatever your needs are? Or on a personal level, if you just don't have the resources, the money to get your medicine, what can you do to help yourself in the meantime? What can you do to sustain your wellness? So this is like a constellation of meanings here, really, sustainable medicine. But we're not talking about like, IV drip bars or like, what is it? Just, there's a term where you just try to do something really fast and quick and thinking it'll be a quick fix.
Yeah. Okay.
It's like I'm playing charades with myself. But anyway, not charades, but yeah. So we're not talking about quick fixes, although plants can work very quickly and effectively. But it's not the mindset around it. Okay. Next slide, please. Thanks, Jennifer. Plant medicine have preparations. Sun, do you want to share anything here on this slide? Share any knowledge about the different
form. Well, to start with truest form, so I'm looking out at this medicinal swale that everyone here has helped plant and grow and nurture and take care of and harvest, but that would be obviously its truest form. You go out in your garden, a communal garden, and you pick fresh leaves, immediately go into your kitchen and put them in tea form, and you don't need a lot, so you need a hot water, heat it up. You can even, if you don't even have that, if you are struggling and you know there's medicine out there and know what it is, you can just go out there and just eat it. This is like the truest form of common sense. So I think a big part of trusting ourselves again is having the knowledge that we can identify plants on our own, and it's right out there for you. The books are there, the internet's there to see what's available, and out there and eating them on your own is something that can help you. So I think that's what that means with truest form. And then, so making teas, that's probably the easiest way I think that most, I would say, the average person can help themselves if there's something, that they're having an issue with. If they have the plant available to them, they can just pick the leaves. They can do it fresh, or you can dry them, hang them in a barn, hang them in your own home, just keep them away from sunlight, and it keeps the chlorophyll in there, and it dries naturally, and it stays in the plant. So that's the reason you don't want a plant ever really having direct sunlight when you're drying it. Why you always see them in barns is because there's no windows, but you don't want the sun to soak out the chlorophyll, which is like one of the main ingredients with the medicinal properties and compounds in any plant that you are trying to use for medicinal reasons, whether it's high blood pressure, type 1 diabetes, anything, arthritis, inflammation, fibromyalgia, you name it, aside from something that you would probably need immediate surgery for, even herbs there for your gallbladder when it's inflamed. And a lot of people go directly to get surgery for that too. So it's just all available to us. Okay, tinctures. Yes. So just a quick, if anyone has ever wondered, what's the difference between its glycerin tincture base or alcohol tincture base? So I like using alcohol tincture base, 80 proof to 100 proof, because it has a super high absorption rate, and also it keeps the potency. This is super important when you are truly having a chronic issue especially, but also something acute that you need help with, for example, lowering your blood pressure, sorry. But you want to have the potency in there. So glycerin over time will take away the potency of that plant. Also, it has a shelf life. So glycerin it can last a year to 2 years, where a tincture will last your lifetime. You'll probably use it up, because you're using it on a regular basis, but a tincture has no shelf life. It can go until the end. If you put it in a room temperature, cupboard or something like that, away from direct sunlight again. And capsules, that's just grinding up the dry of course, dry plant, and putting them in capsule form and drinking them. A lot of plants are very bitter. A lot of people say they taste like dirt. It's true. I like the taste of dirt.
We should get more used to the taste of dirt.
Yeah, it's quite pleasant actually, like mushrooms. But if someone has a strange palate, not their palate's strange, but you know what I mean. If they just don't like the taste of certain things, it's fine. Put it in a capsule, swallow it. I mean, that's where we get most supplements, right? That's what they are in the store. So there you go. Difference in plant form uses oh man, yes. So absorption is huge. I mean, this, I would say that obviously every person's different. I have a very sensitive affinity for the touch of herbs, especially psychedelics. When working with growing mushrooms, just touching a mushroom, I could start feeling effects. And some people will never have that. So you're talking on a low range of sensitivity-wise of that, as to they're going to eat half a pound of mushrooms and not feel anything. So it's very important to figure out what your body will absorb, and so that's where the dosage conversation comes into effect.
Yeah. So you mentioned a big point there, Sun, that when it comes to absorption, really all of those bioavailability, absorption, personal tolerance, that's different, but that is unique to you, and that's also affected by the type of preparation that you use. So both of those are factored in. Bioavailability, let's say I'm talking about turmeric. If I use a turmeric extract, the availability is different than if I drink turmeric tea, right? Those compounds getting to where I need them to get to. That could be a whole talk in itself. But these are things to consider if you're taking any, and I can use the word supplement, because it doesn't, we think of pills or capsules, at least I do when I say supplement. But if you're taking any of these things to benefit yourself, you're supplementing yourself. But those are things to think about when you're trying botanical medicines, supplements in whatever form. Think about how well your body is going to absorb them based on the form that you're taking it in. At the same time, the intensity or the potency, as Sun was referring to, of what you take is affected by the form. So it all depends. You know, if you want something to affect you topically, if it's your skin that you're working with, okay. Then you're going to use it in its purest form and truest form, and you're not going to miss any of its bioavailability. But it's important to understand that the more processes that it goes through in your body to get to where you need to get to, the less that you're going to receive of it if you're taking it in a whole form. Yeah. So something to think about. And also when we talk about tolerance, that's a little bit, that comes after whatever you have absorbed, right? I was harvesting mushrooms, I absorbed this, how's my tolerance? Does it give me symptoms, like sick symptoms, because I'm not actually sick, I'm not used to it? Did I not feel it at all? So I need to try twice as much as whatever it was that I took. So these are just all things that you want to ask yourself and consider when you're trying any plant medicine. And they're questions to ask because often we'll try things and we'll be like, oh, that didn't work. Or we'll try something and be like, oh, that made me horribly sick. But we haven't taken the time to reflect on what we even did, what was in our body, what we put into our body. So just good personal questions to ask. I think we can go on to the next slide. So, as we were talking and getting this together, we realized that there's like so much to unpack. We could talk a really long time about things.
Yes.
So we decided we better just focus on a few things.
A couple, yeah.
Those are things we were thinking about, but lobelia, comfrey, and then turmeric. I'll share a bit about.
Okay.
Yeah, what we'll go for today.
And I wrote notes because I just have a really bad short-term memory nowadays, even though, yeah, so I'd like to read actually. But I'd like to say in 1880, Charles Darwin, who we all know, he was even stating about what a lot of scientists aren't really on board with as far as calling a plant intelligent, right? Because it doesn't have a nucleus. It's not considered to have a consciousness according to scientists. But going back to the beginning of medicine found by indigenous people in all over the world, it is consciousness. That is consciousness because it is from the earth. The entire globe is aware. And the first fact in that is if you think about different types of herbs or plants, they mimic what a human being needs to heal. Okay, so when I say that, a few examples are slippery elm bark. It's mucousy, so when you see the seeds, they're surrounded by a mucousy film. That is to heal congestion, anything when you have mucus lodged in your chest. It helps draw out that sickness and gets it out of your body. I'm sure people have heard of the tea throat coat. It's by a wonderful tea brand, and that has slippery elm in there. Another example for women issues, red raspberry leaf and red clover. It's the color of your menstrual cycle. This was to show indigenous people, through learning and time, that, oh, this helps with regulating your menstruation, helping with cramps, helping remove cysts, okay, instead of having them lasered off. Aiding, like blue cohosh, aiding in strengthening circulation in your uterus. And there's so many other plants that will look or feel the way that they help a symptom that you might have. So when I'm thinking intelligent, that's pretty intelligent. So starting with lobelia was one that I wanted to talk about. But when you're talking about intelligent, cayenne pepper is also one where when you ingest it or put it on topically, it knows where to go, which is wild to think about because there's so many different parts of your body. So what it's saying in that case is when ingested, lobelia will find the imbalance in your body, whether it's arthritis or whether it's tuberculosis, whether it's lodged in the chest. The medicine will, that compound that's in lobelia called lobeline, and there's many different compounds, but that compound will go to the area that it's needed and start to repair and balance that out. Lobelia is, the parts that are used are the seed, pods, and leaves. It has been scientifically proven in double-blind placebos to help with ADHD, depression, asthma, pain, all coughs you can imagine. So that goes from TB to dry coughs, mucus coughs, anything like that. But the main alkaloid in it, lobeline, it interacts with the nicotinic receptors and other neurotransmitter systems in the body. So it can, it's used pretty widely actually as to help people quit smoking because of that fact of cutting off those neurotransmitters and basically replacing the nicotine that you're craving. So instead of patches, you could do 1 dropper full of a tincture of lobelia, you know, and it's about 50 milligrams. It stimulates the vagus nerve, which activates.
Oh yes. Could you repeat the last part you just said about dosage or how much you might want to use?
Yes. So in a tincture, when you have a 1 ounce tincture, 1 dropper full is usually the recommended, which is about 20 to 30 drops. And that is pretty widespread, but you always want to read the label of your tincture, of course, because every herb is going to be different. And by the brand, it will be, the potency will be different, and it'll have the ratio on it, whether it says 3 to 1, you know, herb to alcohol tincture ratio there. But usually 1 dropper is about what you take. And let's see. Oh, so it helps with the parasympathetic rest and digest response. So it can help calm the body and mind. So when we're talking about ADHD, it lowers your adrenaline levels, reduces the fight or flight stress response, and promotes relaxation and ease anxiety. It's also an antispasmodic. So when we were talking about aids in relieving coughs, that's what that's doing. It relaxes the muscles and smooths the muscles in the bronchial tubes, which can be useful when you're experiencing nervousness as well. So anxiety it can help with because it's loosening up the bronchial systems in your chest. And then by relaxing the diaphragm, it aids in respiratory function. So it helps that run smoother as well. So safety considerations with lobelia, as I slightly mentioned, 1 dropper is usually where you want to start. So 1 dropper is about 20 drops. That would be, if you're doing it capsule form, would be about 50 milligrams. So that's 2 capsules. So that's kind of the ratio there. There is a high dose toxicity warning on that. So the medicinal dosage can be closely related to its toxicity. So like when we were saying, you know, make sure that you're checking your dosage, you could easily, if you're not counting your droppers, take an extra dropper, but you can take up to 400 milligrams of this and it would be okay. But it is a warning that's put out there with an FDA, just awareness of that.
And just a little extra on that, one of the reasons that there's such a delicate space between therapeutic and toxic is because it's acting on your central nervous system, right? Which includes your brain. And so the body likes its status quo, and it protects you. It's not going to let you go too far out of its range. And it's very selective with what it allows to work within that system, right? So if it's like, this isn't good for you, it'll reject it, and then you feel those symptoms. So,
which are nausea, vomiting, and dizziness.
Right. So again, knowing your body, really being mindful, right, about what you're actually putting in your quantities after the night.
Right. Yeah, absolutely. And then I did want to mention a recent study. In addition to fighting free radicals, lobeline aided brain signaling pathways, which is showing promising help to slow down Parkinson's disease. All right, so this was in the last decade or so that scientists are looking at lobelia to help with that. My references are for this Louise Tenney from the Health Handbook, Dr. Christopher, and I'm gonna butcher this, pharmacognosy and pharmacopoeia technology from Baltimore, Maryland, Williams and Wilkins from 1996. And then comfrey, which a lot of people have heard of. It's mainly used in an all-purpose solve. Everyone loves comfrey, and that grows out here, wild everywhere as well. Yeah.
I'd like to ask, it would be great to cultivate lobelia, right?
Yes.
For us to grow some lobelia.
Yes, I tried to do some. They did not do well, but I think that the setting could have been better.
They need a wet foot, right?
They do, and I think that if you have some, like the lower end of the swale, medicinal swale, where it collects.
I know, Kuthi there, I was also, we have kind of like a bit of a little dry pond spring area that's down in the corner of the park near Gene Wilson's, and maybe we could just plant some wild out there.
Yes, I have 3 packets of lobelia seeds that we can use.
We should try, maybe grow some nettles down there or something too.
Okay. Yeah, that would be great. I mean, it really is. It's actually the Dr. Christopher who has been, he's passed, but his family still sells tinctures, salves, products on the internet. They're pretty widely known. But he puts lobelia in almost every single medicine that they produce because it's also known as a well-being herb, which says something. And it's not a lot, a few drops in each other tincture that he uses. You'll see that that's one of the lower ingredients.
Is there different types of lobelia? Do you see?
No, with comfrey, yes, there is, which I'll talk about in a moment. But lobelia is lobelia.
There's different lobelia type plants, but they're not the medicinal
type plants. Yes.
Yeah, in the lobelia family.
Yes, so there's actually the non-medicinal one gets sold at nurseries everywhere. Yeah. It's a stunning, beautiful, violet, little precious flower, and it's gorgeous for your annual garden. Absolutely, yep. But yes, the medicinal. Oh my goodness.
Is it lobelia syphilitica?
No, it's lobelia and flock.
Sorry, I don't want to get
wrote it down. I'm sorry.
Did you sidetrack?
No, you're good.
Lobelia.
It's lobelia, and then I thought it was fauna, but that.
Is the water potable from the sinks?
Oh, I brought water. Let me pull it out. It's in Megan's back in the spot. I didn't. Oh, I got some water, Hunter.
Oh gosh. Yes, it's lobelia inflata. I might need to go in just a few minutes. I'm so sorry.
You've got to do it.
All right. Just to touch on comfrey real quick. This is strictly for topical use only, all right? So I'm going to say that again. Comfrey is for topical use only. It is illegal to ingest it. I don't know of any herbal farm or company that puts it in their tinctures because it's not allowed anymore. It has a high carcinogenic rate and hepatotoxicity. Over a short amount of time, the compounds in it actually cause cancer, which is the carcinogenic factor. Ironically, comfrey is one of the best plants to help with killing the cells of all types of cancer. So it's a fun little joke there that Mother Nature has put out. So
since we might have a greater audience, I just want to make sure I say what you said again.
Yes.
On the mic, you said that it's illegal to do what with comfrey?
It is illegal by the FDA to consume and ingest comfrey, any types of medicinal comfrey, because of the carcinogenic and hepatotoxicity alkaloids called PAs. It can cause liver damage and lung damage.
So hepato, that's liver, right? It can cause liver damage. Yeah.
Yes. Basically, not to say in layman's terms, but it has the same compound that paint chips has. And remember when it was found that, hey, don't eat paint chips. It's the same compound that's in comfrey. But topically, it is a wonderful, powerful, potent plant to use as a poultice mostly. You mix it, you grind it, and you put it on where your cancer is. So the biggest effect for comfrey is losing the roots and leaves. And in the compound in that is called polydihydroxyphenyl glyceric acid. Okay, that is in short, P-DGA. It suppresses the growth and induce programmed cell death called apoptosis in prostate cancer cells. It destroys amoebic-like bacteria as well as prevents further growth. So it's going in there and kills the cancer cells, which that compound is called allotonin. Then it also has a compound called rosmarinic acid, which is in other plants, but this has a high potency of that. It has been proven to help with oral breast and pancreatic cancers as well as others.
When using it topically or when using it how?
Topically. And usually people use a poultice.
What is a poultice?
So poultice is, you basically get it wet. You grind the herb and to where it's wet with water, and you use a wrap to hold the herb in. Usually like a bandage cloth or a thin layer cloth where the herb can come through, and you place it where you need to, and you wear it there for hours. Usually it's wrapped around you and you can walk around with it, but over a period of 6 months is usually when patients have noticed tumor size decrease and even full recovery. So this is many decades of research and even personal, not me, but 2 members of my family doing that instead of chemotherapy, and was relieved of their cancer. But yeah, again, it's also used for bug bites and for healing skin wounds, scratches, and all that. But it is definitely a powerful plant to have available to people if they want to learn how to use that. Not mentioned. That's right.
Thank you so much, Sun.
Thank you, and I really enjoyed this experience.
I didn't get to say that. I was like looking forward to hearing your parts just for me. So I learned a lot today. Thank you. Thank you. Ooh.
I'll see you later.
Totally, totally. Hold on.
I will.
Thanks for coming, Michael. You came to support this baby girl.
I'll be loving your posts on Instagram.
Thank you. Same. We're Instagram friends now. So, do you think you might help change that slide to the next one? Or Hunter's coming back. Oh, I'm sorry.
Yeah, I already did.
I didn't even notice. Thank you. Going back. So, moving on to a different part of the world. Not that turmeric isn't used here, or known by the indigenous peoples of this land, but it's very well known and used and associated with African, West African cultures and India and Ayurvedic traditions, notably. So, turmeric is something that I use daily now. Has anti-inflammatory properties. It's important not to classify herbs into different categories and say it's an anti-inflammatory. A leaf, ibuprofen, is designed specifically to pause the anti-inflammatory process by different means, so they are anti-inflammatories. Whereas plants have these properties, as Sun was referring to earlier though, with plant intelligence and wisdom, they can be working on so many different things at once. So this is something that's very notable and that we see in herbs like turmeric. It's also important to remember that, because if you don't, you might not be aware that it's having impacts other places in the body or in other ways. So again, that body awareness and really understanding that plants are very powerful, and once they're in the body, they're going to do their thing. We can't really put limits on them, so having that respect and balance. So turmeric is known to it's known to help decrease blood sugar, whether you have diabetes or not, and you have high blood sugars for other reasons. It helps thin the blood, and that can be a good thing if you happen to be taking any blood thinners, or if you have any clotting disorders, you want to be careful and exercise without certain balance here. Often it happens that we may be fine, but we may know that mom has, she's got a heart issue or whatever, and we want to help her get healthier. So we're like, hey mom, drink this tea. So even if that doesn't apply to you, something you want to be careful about when you share things with others, especially family, trying to help them get on a better path, understanding how these herbs, plants, botanicals might impact them in different ways you weren't intending. Turmeric is great for cholesterol, great for blood pressure. Again, if you're already taking pharmaceutical medicines for these things, you want to think about, do I need to decrease what I'm taking? Do I need to talk to somebody about that first? Do I need to monitor my blood pressures more often while I'm taking it? If it's something that you want to really help and do regularly by means of botanical medicines, those are things you may want to consider doing. I have turmeric in the back, and I was going to be like, this much is like 2 grams. One of those knobs is like 2 grams. And that much a day, I chop it up in my tea, I put it in my coffee, I put it in my green shakes. It's something that over the long term, it can help with pain, inflammation, blood pressures, as we said, cholesterol. If you have it 5 times a day, then you might not you may have effects that you weren't intending. So I think the point is with any of the herbs that we're talking about or any plants is moderation, and actually we'll be talking about that shortly. It can cause, if you go crazy with it, like anything, bleeding, internal bleeding, not recommended for pregnant women. Baby may not be able to handle that in uterine, but it's also very good as an antioxidant, metabolic support, if you're working on maintaining or losing weight. So let's go on to this more safety stuff, more specific safety talk. As we said before, botanical medicines are very powerful going on. Thank you. So whatever it is that you decide to explore, recommendation in general is to just start with one herb. If you really want to start building these into your lifestyle and you know that you're prone to respiratory infections, or you have back pain, or you've got eye trouble, whatever it is that you want to help, take one, start with one at a time, start with the lowest amount, start at a time of day that you can do it regularly. Then you'll know if it's actually the herb that is helping you, or if there are other changes in your life that are affecting whatever outcome you see. As we just said, and Sun was saying before, herbs can work in different ways. So maybe you only wanted to take it for your cholesterol, but it's going to help your blood pressure too. So if you start taking 3 herbs at once, how are you going to know which actually helped you? So best to start with one and see how it works in your body uniquely. If you would like to see more impact, then start to increase that. Know how much you're taking, or else you won't be able to replicate it. Just like when you make that perfect dish, but you don't know what you did, so you can't do it again. So know what you're doing. Know what you're doing. If you're taking supplements that are capsules and they've got all the dosages on the back, that makes it super easy. Is it always ideal? No, but it can be practical. I definitely like to take a whole plant and use that if I can, because just the way drinking apple juice or eating an apple have completely different experiences in your body. The juice, it has its own experience, and the apple in your body. Taking an extract or a part of a plant that's been prepared as a supplement is different than using the whole plant, because all of the components of it work together. So something to think about. Whatever form you choose, just know what you're doing and how much in general. If you just are great at remembering, like I always think I'll be the first week of something, then great. By a month later, I'm like, I have no idea, because life happens. So if you can just, record what you're doing, talk it out, text it to yourself, just keep track. Can we go to the next slide, my friend? Okay, we talked about plant intelligence. Also very important is body intelligence. And what I mean by that is that when we think about our exposome, all of the things we've been exposed to in our lifetime, good, bad, don't know yet, like COVID vaccines or whatever, not that we're being political. Your body is so incredible that whatever you put in it, it's going to be like, okay, I wasn't expecting this, no one else, or we've never had this before, but I'm going to work around it. And even if this would make you sick, usually I'm going to bring you back to a place of status quo and make you feel okay. Your body is always compensating for things that are not necessarily good for it, that go into your body, and some things that stay there forever. And so when we all of a sudden decide, oh, I'm going to get better, I'm going to get healthier, the body's like, whoa, I already got used to you being not healthy. And so it has to establish new baselines. And so respecting that, and that it's doing an incredible job by doing that, it's, again, good to start slowly with things and go gradually with it if we're going to increase. And to realize that, if something makes us feel not well, that's your body unlearning the way that it's had to be to support you. So just remember that. And I use that as an example. For instance, if you were starting to use lobelia or turmeric and you realize that it affected your blood pressure, like all of a sudden you feel dizzy in the mornings, you feel woozy, check your blood pressure, and maybe it's okay, you're like, my blood pressure's not low, but your body's gotten so used to you, perhaps not you all, but someone, mom, grandma, being at a high blood pressure, it doesn't know yet how to be at a blood pressure that's lower and healthier. Yet these herbs can have that impact on us. Again, reasons why we want to do things gradually and let the body reestablish its status quo. And I love this. Really, I was talking with a friend this week, and it just kind of came out. It's like, remember, we were walking GMOs. Like, I mean, the rare person who's lived off-grid all of their life, yes. But if we've gotten any plastic, genetically modified organisms in our body, they've had an effect on us, right? And so our body has learned to compensate for those. So all of a sudden, when we're getting more organic, really good stuff in our body, it may not know what to do with it if it's been dealing with the crap the whole time. So give yourself some grace, your body some grace, and just really, I'm just amazed at the work it does to keep us up and running all the time. Next slide, please. And as Sun was mentioning before, you know, if someone says, hey, we're growing comfrey at the farm here now. You want some? Like, yeah. And you take it home and you're going to do something with it. Exercise humility, because understanding that not all plants are, the plant itself knows, like, listen, you're not supposed to eat me. That's why some plants have different colors and protection mechanisms on them, whatever. But you can put me on your skin or whatever it is, or they taste bitter. So not everything is safe by all routes. That means mucosally, essentially, we're talking about through the eyes, through the nose, through the mouth, vaginally, rectally. I made up a word. Not all things are safe by those mucosal routes that we would be safe if we inhaled it or if we put it on our skin in the south. So know which route is actually safe for that herb. And I love a little friend there who's getting into her body, knowing her body, and that's just the most important place to start. Also important that if you're going to do supplements that are prepared as such, know your sources. NSF is a certain certification that supplements can receive to say that they've been checked out by so many labs, reputable labs, and providers, doctors. And it can be helpful because everyone out there, anyone who can set up a website can, you know, package some stuff and ship it out to you. It could be contaminated, there could be mold, there could be sawdust in it. So if you're going to buy it, especially not from someone local, really know where you're getting it. And we can go to the next slide.
I'm trying.
Okay, this is something I really love to talk about, and it's something that I hope you'll share with our friends in the holistic community. It's happened that because of the way healthcare is set up, sometimes we just don't want to be bothered with it. So you're sick, your partner's like, hey, what's that thing? You need to go get it checked out. It's been there a while, it's too long. And you're like, no, I don't want to deal with, I just don't want to deal with having to go to the doctor, all this, whatever. But remember, that's totally cool and acceptable. But ownership of your health is yours. Autonomy, decision-making over your body is yours. Why not consider working the system? Like, if you got something you need to get checked out, you don't know what it is, go get your lab work and decide when they make their recommendations if you want to do it or not. You can always refuse. And guess what? You can go and refuse whatever they suggest, and no doctor will ever be like, well, I'm just not going to see you anymore. They don't. They will see you. So take advantage of it. If you just want to know what your blood work is and you can't test it yourself, or if you don't want to be exposed to rays, understandable. If you need an x-ray though, and it makes sense to do it, why not do it? And then you totally decide where you're going to go from there. But I definitely, if it's within your values and your ethics, if you can take advantage of it and really hold that power yourself within that setting, I definitely recommend it. Especially if you got insurance, use it while you can. Something I didn't say about that before, but I'll be more specific now, is that a concern that I do have in the way of a provider in the healthcare world is that not many people realize that Medicaid and Medicare set the standard for other insurances. So what they do, eventually other insurance companies copy. And so there's a real concern that changes that we have coming with Medicaid are definitely going to ripple out to other insurances. And thus this whole talk again, and just being prepared, using the resources we have, and being able to really have that autonomy outside of the healthcare system, and using earth medicine and whatever tools we have at our disposal. And I address that to, I'm not trying to pick on anyone, but friends in the holistic community, because I've seen it happen firsthand, and I sort of have experienced it myself too. Sometimes where there's a self-shaming or other shaming, like, oh, you couldn't solve it, you couldn't get whatever fixed with plant medicine, or whatever, you had to go to the doctor, even if it's more subtle. But I think we should realize that we're living in a time and system and bodies that were nowhere like our ancestors, right? They weren't exposed to the things we were. So give yourself some grace and understanding that there's so much that has made you the person that you are that you didn't even have any control over. Now you're learning, you've been learning, you may be an expert, but there are things that are set in motion before you ever knew what was what. So, just taking care of yourself in whatever way you think is best, but really let it be what you want. Let it be what you want. So anyway, that's my soapbox. Can we go to the next slide? It's that time. So, just talking about where we can find some support locally. We can go to the next slide, and if there's anything you all would like to share. Again, I see faces that feel like they're ready to share stories out there. But so first, Sunflower. I asked her, what do you think? What would you say your specialty is? She's just got an array, just a storehouse of knowledge about plant medicine. But I do know pain is something that she's pretty proficient with. There's also a couple out in Floyd, Virginia, and their business is Ital Acres, and they are awesome. They'll give you workshops out in their property. They'll come and teach. They specialize in tick-borne conditions. So if you ever want to look them up, they make their own stuff. They'll ship it out to you. And next slide, please. So there are local practitioners who are in the integrated and functional fields who are going to be more definitely accepting and acknowledging if you practice plant medicine or use plant medicine. At the same time, there are more synthetic products that these providers may use, maybe not pharmaceutical, but that mimic plant medicine, but that are not actually plant medicine. So something to think about, and whereas they may help you find solutions to certain problems, which is super helpful, and is different than you will find in conventional medicine, it still is different from taking a whole approach. So you still personally want to take that whole approach to your care, and you might find someone locally who can support you in that as well. I want to go to the next slide. I'll go to the bottom. Palin LLC, that's my one-person enterprise, and I definitely can help you with that whole health approach. one or anyone in our community. And I'd like to point out that what I practice is different than integrative and functional medicine, and that the intensity is different. Usually you seek out one of these providers when you're like, I've got a problem with mold, I think, or whatever, and I need solutions to it. Whereas you may just want to optimize your health, or you may know that something's going on, not quite what, and you need someone to help you figure that out. That's where someone who takes a whole health approach can help you. Or if you're working with one of those type of providers, but you're like, but I got all this other stuff going on, and it seems like a cycle, and I don't know what's the chicken or what's the egg. You want someone who takes a whole health approach to help you sort that out and then put it all back together. And there are other whole health providers in the area. If we want to go back just for a second, Hunter, but I would definitely talk with you personally to see what it is that you feel you need before I recommend them. So, if you want to just study up yourself on how I can improve my health with botanical medicine, this guy is absolutely amazing, Sam Kaufman, if you want to look him up. He's got a website, he does consults, I'm pretty sure he does virtual consults, but I think he's out maybe in Colorado. I just met him online this week. But what's really nice is that he was a Green Beret medic, and then he, started working with plant medicine with people, got into medical school actually, and then was like, oh, wait, this is not what I want at all. I can't really help people the way I want to. But he has that knowledge and can translate, which I love how he expresses that, because they are different languages, translate between the two and help people with what they really need, and on a long-term basis. So as chronic care or persistent health conditions. And thank you. If there were some brands you were going to choose for supplements, here are a few. Sun really likes mountain rose herbs also. I'm sure you all know some of the others. Full Script, they're like, doctor vetted, and as we said before, NSF certified, and you can find them on my website if you like. You have to have an account with them, a professional account to purchase, or be associated with someone who does, so you can find that and discount from my site. And then next slide. What are your plant medicine stories? Why do you love plant medicine? What do you do? I'm interested to hear. We, not just me, everyone wants to know. Do you want a mic? Do you want to come up here? Nancy, I'm going to start calling her.
So I missed a big chunk, and I just slid right into it. It was great finish.
Yeah?
Which is so inspiring, Keisha. Did you go, okay, and this seems weird because your subject is holism, right? Did you go into mental health? I don't know, did you?
Yeah.
Okay. Yeah. Did you go into mental health? Since I wasn't here for a period of time. Did you speak to mental health?
Okay. I thought you meant that I studied mental health.
No, did you speak about it when I was missing your presentation?
Okay. She's about to get me on a special soapbox. So, we talked about in the beginning a whole health approach, right? And that all the dimensions of ourselves are part of who we are in our wellness. So mental health can't be separate from physiological health. If I could show you, there's a schematic that shows that the same thing that leads to diabetes leads to depression. Same pathways. What does that tell you? There's no separation between them. We know this. We know about gut health and the effect that has on depression and mental health, all that. So I didn't talk about it specifically, but I'm always talking about mental health. When someone comes to see me, we have like an intake form. The first thing we talk about is emotional and mental health before we start talking about anything that we think of as physical. So, yes and no.
Right.
Yeah. Do you have listen, this is all about sharing knowledge. I'm here because I want to learn. I'm a novice. I am a novice, if you can't tell, with plant medicine. I just know people who know stuff.
Yeah.
What would you like to share about plant medicine and mental health?
I wouldn't separate either of those things. I'm a novice too with learning about health interventions or prescriptions, so to speak, in general. I'm just a human that is. I studied plants in a traditional way. I'm a botanist by undergraduate.
Yes, she's a botanist. She's from holding back.
Right, undergraduate training a long time ago. Okay, before a lot of the new technologies and new understanding with DNA, with genetic sequencing, with a lot of the new things that people who study botany have now. So I never really used that professionally, although I taught science to children.
Okay.
And so I never used it professionally or practiced
Sorry.
in a professional setting. However, I've always been in love with plants, you know, my entire life, and connected with them just in a visceral way. And I'm a novice as far as applying, if you put a name to it, plant medicine, to using plants for healing or anything. I just enjoy them. They're my friends. You know, they're my allies. You know, we talk about plant allies and what they're used for. But I plants are my main food. I do eat animals too, and animal products. But plants are my main food, and that the line between food and medicine has always been the same to me, because I've been overall a healthy person, like no real problems. So, but I understand now, in thinking and reflecting about it more, and people using the term plant medicine, that, and I understand more things about plants than lay people in general. That there's a lot of components of plants that the medicine or the effect is in the dosage, right? Some things you eat like food and you don't worry about it, and other things you don't eat too much of it, and some things you eat very little or you don't eat any of it at all because it's poisonous to you, right? So I sat with an old granny, Ozark granny in 2023 in the summer, who is a botanist and a healer, and she had spent a decade in the woods learning the plants, and she's creating an electronic database. So that was when I began to really think more, and I was retired from teaching and working, so I had more time to contemplate it. Like, well, now I'm getting older now, and I see people that have illnesses, and I'm not just selfish about, oh, I'm healthy, I don't need anything. But sitting with her, I started seeing how plants can be used as medicine more. So started to separate plant medicine from plants to eat, or plants to help the other creatures on the earth, like that. Yeah. Okay. Boy, I'm really going in a lot of directions here.
Your story.
Because my question had been about had you addressed mental health? Because I know many people in their younger in my circle that are really suffering, and I don't know how to help them beyond my friendship and listening to them. I don't have any plans or any practices other than general knowledge about what we all talked about today, about movement and connection and the general things, and maybe send them to some, listen to this podcast, listen to this influencer, but nothing. But you seem to be really have thought of this and are synthesizing all of these things into your practice. Absolutely. Which I love this, Tisha, because this is where I think I might be able to steer some folks. Because we all, like you just heard my little mini bio and background and love for plants and affiliation. But to help someone who is struggling right now, this is wonderful. This is a starting point.